Hello, ladies. I hope you're having a good day. We're going to do part 3 of our lecture for Chapter 5, Module 152. So I'm going to do screen share with you. Let's see. So we're starting with Chapter 3 of our ICD-10, which is the disease of the blood and blood-forming organs and certain disorders involving the immune mechanism, which starts with D50 through D89. So frequently reported codes are anemia, coagulation defects, other disorders of blood and blood-forming organs. And here in the little diagram is some symptoms of anemia. This is the chapter where codes for blood disorders will be found. These are not only disorders of the blood, but also of the blood-forming organs. Anemia is the most common blood disease, which is D64.9. Under the main term of anemia are many subterms that relate to the type or cause of the anemia. Okay, now we're moving into endocrine, nutritional, and metabolic diseases in Chapter 4. E00 through E89. The diabetes codes start with E08 and they go through E13. Type 1 diabetes, I'm skipping through because you guys can read the not elsewhere classified and chemical induced. But type 1 starts with the E10 and type 2 starts with the E11, and other specified diabetes mellitus is E13. The endocrine system consists of glands that are located throughout the body and are responsible for secreting hormones into the bloodstream. What are some examples of endocrine disorders or diseases? There's diabetes, goiters, hyperthyroidism, hypothyroidism, vitamin deficiencies, and dehydration, for just a few. Let's talk about diabetes. Diabetes mellitus, or DM codes, are combination codes that include type of DM, body system affected, and complications. For example, E10.21, type 1 diabetes mellitus with diabetic neuropathy. If the type of diabetes is not stated, you're going to query the physician. So now we're moving on to Chapter 5, which is going to be our mental, behavioral, and neurodevelopmental disorders. And that's going to go from F01 through F99. Understanding the definition of mental disorders is necessary to code accurately. Report only the diagnosis documented in the medical record. For example, you're going to have alcohol dependence and use as F10, opioids, cannabis, sedatives, cocaine, stimulants, hallucinogens, and nicotine, F11 through F19. Psychological disorders are F20 through F29. Mood disorders such as F30 and F39, those are mood disorders, and it's such as bipolar disorder. Sorry about that. We're going to continue on with mental, behavioral, and neurodevelopmental disorders. Anxiety, behavioral syndromes, adult personality and behavior, intellectual disabilities, developmental disorders, child or adolescent behavioral and emotional disorders, and then you have mental unspecified disorder, which is F99. I did not go through those letters and numbers because you can read those on your own. They just get tongue-tied when you start putting all that in there. Pain. Pain disorders related to psychological factors, you're going to report G89 for pain and F45.41 for pain related to psychological factors. Now we're moving into dementia. F01, vascular dementia, F02, dementia and disease classified elsewhere, and F03, unspecified dementia. Okay, I am not going to go through this. We're not going to listen to this just for time purposes, but I will add a link to boot camp mental and behavioral disorders along with this lecture. Disease of the nervous systems is going to be Chapter 6. Hang on, I'm trying to get my There we go. This chapter uses some combination codes in which one code identifies both the manifestation and the etiology. The chapter also includes some combinations that are manifestations of other diseases. These categories appear in italics in the tabular list and instruct the coder to code the underlying disease process first. Non-psychological pain. Localized pain is reported with codes throughout the I-10. For example, ear pain, H92.0, or limb pain, M79.6. Category G89 is NEC, not elsewhere classified pain. For example, G8911 NEC, acute pain due to trauma, or G8921 NEC, chronic pain due to trauma. R52 reports unspecified pain that is acute, chronic, generalized, or not otherwise specified. Talk about dominant and non-dominant sides. Dominant side, right or left-handed. Paralysis or plegia is reported based on dominant or non-dominant side. There are some examples. I'm not going to read through all of those. You guys can pause the video and read through those more closely. If the dominant is unknown, report dominant as if it is the right side. Diseases of the eye and adnexa. H00 through H59 does not contain all the eye and adnexa codes. Chapter 2 excludes 2 directs to other categories such as injury, trauma of the eye and orbit is S05. Injury, poisoning, and certain other consequences of external causes, S00 through T88, and neoplasm, C00 through 649. Now, do I realize that I'm reading you letters and numbers? I do. But if you pause the video and you actually open up your ICD-10 and you begin to look at these codes that we're talking about and bubble and highlighting them and labeling them in your way, you're going to be ahead of the game. Okay, here is a picture of the structure of the eye. And then I have a Khan Academy video on the structure of the eye. I will not include that in the link, but you're more than welcome to go to khanacademy.com or go to YouTube and go Khan Academy, the structure of the eye, and you can pull this video up on YouTube. Hordeolum is the infection of the sebaceous glands or a sty reported on the location and type. Right or left, upper, lower, or unspecified. External, report 800.81. Internal, you report 800.2. Chalazion, there we go. Infection of the eye that forms mass reported on location 800.1. So guys, we've all had styes on our eye, but we never really thought about that much. Until we started getting into these ICD-10 codes and realizing that everything that you have, every condition, every disease, every sign actually is allotted a number, an alphanumeric number. Entropion and Ectropion. Entropion, turning inward of the eyelid, is H02.0. Ectropion, turning outward of the eye, H02.1. Lacrimal system. Category H04. Codes reported on the right, left, bilateral, unspecified, such as, and I'm going to let you read through those codes and look at them in your ICD-10, bubble and highlight. Disease of the ear and mastoid process, Chapter 8. H60 through H95 codes report disease of external middle and inner ear, as well as mastoid, other, and surgical complications not elsewhere classified. Again, you guys can see that I have another video over here. It's the ICD-10 boot camp. Now let's go all the way to Chapter 9, which is the circulatory system. I00 through I99 excludes 2. Note indicates other categories for other circulatory conditions. Circulatory conditions such as neoplasms, symptoms, signs, and abnormal clinical and laboratory findings not elsewhere classified. R00 through R94 is systematic connective tissue disorder. Oh, I'm sorry. Let's go back. Signs and symptoms of abnormal clinical and laboratory findings is R00 through R94. Now, we already had one coding scenario where we had to really look for abnormal, remember the abnormal cardiac monitor? That wasn't the monitor. I can't remember what test we had, but that's where it was found in those R00 through R94. Systematic connective tissue disorders is M30 through M36. I00 through I99 reports conditions such as rheumatic fever, hypertension, ischemic heart disease, cerebrovascular disease, and etc. This chapter contains codes for diseases of the heart and blood vessels. Hypertension is one of the most common conditions coded in this chapter. I'm not going to go through these simply because we're going to be doing those tomorrow in our workbook when we get together for our Zoom class. Okay, report I-10 includes arterial, benign, essential, malignant, primary, and systematic. Okay, hypertension, I-10, we are going to be using this so much, I-10, but what I want you to know is it does not cover everything, everything that says hypertension, because there's hypertension with kidney disease. There's just so many different things. So we need to pay close attention when we're actually coding hypertension. Transient, temporary, RO3.0, elevated blood pressure without diagnosis of hypertension. During or due to pregnancy is going to be 013 through 014. Chronic kidney disease. So you guys have had some practice with looking at end-stage renal disease and different stages of kidney disease because we've coded some of those previously to this. The appropriate code from this category is going to be N18. Chronic kidney disease is reported as a secondary code to I12.9 to identify the stage of chronic kidney disease. No causal link is assumed in acute kidney disease. Assume a relationship between chronic kidney disease and the hypertension. I13 combination code for category hypertensive heart and chronic kidney disease. If heart disease is present, assign a category of I50 point, and you have to find the correct code for that. Again, if you guys get into your ICD-10s and you start looking at these codes for these slides, it's going to really, really be great aha moments for y'all. Chronic kidney disease and hypertension. These are all of your combination codes. Stage 1, stage 2, stage 3, stage 4, there you go. There they are. So really get in your ICD-10 and start digging and looking at those and highlighting and making notes and studying those. If the physician does not state the stage of renal dysfunction, you have to query the physician. There is no assumed causal relationship between acute renal disease and hypertension. But if it was chronic renal disease, then there was probably a link and a relationship. But acute symptoms are not going to be. Myocardial infarction. So, in case you don't know what that means, it means a heart attack. Acute heart attack with occlusion of coronary artery, STEMI, ST elevation, MI, myocardial infarction, most severe total occlusion. So, total occlusion is the most severe. For example, I21.01, ST elevation, which is STEMI, myocardial infarction involving left main coronary artery. NSTEMI or non-ST elevation MI, less severe, and it's a partial occlusion. For example, I-214.4, non-STEMI elevation, myocardial infarction. Now get into your ICD-10 and look at these codes and look at what's around them and familiarize yourself with it. What is a STEMI? ST elevation myocardial infarction, STEMI, is a very serious type of heart attack during which one of the heart's major arteries is blocked. ST segment elevation is an abnormality detected on the 12-lead ECG. What is NSTEMI? Is a type of heart attack. NSTEMI stands for non-ST elevation myocardial infarction. Sometimes an NSTEMI is known as a non-STEMI. A myocardial infarction is the medical term for a heart attack. ST refers to the ST segment, which is part of the EKG heart tracing used to diagnose a heart attack. Myocardial infarction is an acute heart attack that occurs when a coronary artery is blocked. Category I-21, MI, requires specific documentation in the medical record to indicate the infarction site. Subsequent STEMI or NSTEMI are reported with I-22. For example, I-22.1 subsequent ST elevation STEMI, myocardial infarction of inferior wall. Complications within 28 days of the initial MI, I-23. Example, I-23.1, arterial septal defect as current complication following acute myocardial infarction. When the infarction site is not indicated, query the physician. Assign the default code I-21.9. Okay, we're gonna do these tomorrow. Sorry, let me get through. When you're in class, we do all of those things, but to be honest with you, we have to kind of skirt through these because there's so many other things to get to. Diseases of the respiratory system, chapter 10, J00 through J99. Some codes are combination codes that identify condition and causative organism. Example, J03.01, acute recurrent staphylococcal tonsillitis. Other codes require separate reporting of the organism. For example, J01.01, acute recurrent maxillary sinusitis. You're going to use an additional code, B95 through B97, to identify the infectious agent. Okay, I am going to stop and we're going to do this one because I know I scrolled through a lot of the other ones. So here's our clinical scenario. A 62-year-old female presents to your office with classic symptoms of sinusitis. She has no known risk factors other than sharing a household with her husband who smokes in the residence. On examination, you are able to elicit tenderness over the maxillary sinuses only. You place her on a 2-week course of oral antibiotics and assign the code. So if you want to take a moment and pause the video and code this, and I'm going to go ahead and move forward to the answer. But again, pause. What do you think the diagnosis is, and what do you think the diagnosis code is? J01.00. So I'm going to grab my ICD-10 from right here. I have it under some other books. Let's see. I just want to read what J01.00 is. It's acute maxillary sinusitis unspecified. So if you said that the ICD-10 code was sinusitis, you would be right. But it's not chronic, it's acute because it came on very quickly and it will probably go away after her antibiotics, right? Okay, so let's code one more and then we're going to call it a day. A 4-year-old male is brought into your office with an acute sore throat. a rapid stress test is positive, and you place him on the appropriate course of penicillin. You code the visit. What is your diagnosis code? What does this poor fella have? He has JO3.00. So JO3.00 is acute streptococcal tonsillitis. Why does he have strep? Well, they did a strep test and it's positive. Strep is short for streptococcal. Okay, so let me stop our share. I hope you guys learned something. I know there's a lot of alphanumeric numbers and stuff that I'm saying, but I want to encourage you, get into those ICD-10s. If we were actually in the classroom, we would stop and we would look at those codes together. Since you're at home, I'm going to leave it up to your capable hands to stop and really look at those codes. Because the more that you stop now and you take the time to get familiarized with these things, the better you're going to be at coding later on and as we go through this process. I made a decision after I said that I would attach a link to the boot camps. I'm not going to do that. The boot camps are on YouTube, and all you have to put in is ICD-10 boot camp neoplasms, ICD-10 boot camp parasitic diseases. You can you can just do ICD-10 boot camp and it will bring up all kinds of things for you. Now, I'm not saying that I'm not infrequently going to assign those as part of an assignment, but I'm not going to actually attach that. Guys, any knowledge that you can get on and start digging up for yourselves is only going to benefit you. Okay, so tomorrow, or it's actually today, I'm making this on Tuesday, and I will see you guys on Wednesday. I will see you for our coding tomorrow, and have a good day. Bye-bye.